This is the Down and Dirty on Abdominal Aortic Aneurysm Ultrasound. I have a quick question for you. According to the U.S. Preventative Services Task Force, who should be screened for a AAA? I want you to pause the video and read through this, then answer the question. The answer is A, the 71-year-old man who quit smoking 30 years ago. Why is it? The U.S. Preventive Services Task Force recommends screening for men 65 to 75 who have ever smoked. That's a grade B recommendation. But remember, this is screening in asymptomatic people, which is different than testing for symptomatic people. The prevalence of a AAA in this screen group is about 3 in every 1,000 men, and this reduces mortality about 0.3 to 0.1%. The basic information on AAAs, there's a lot of deaths, about 30,000 deaths per year. It's most common in males over 60. A 2 centimeter aorta is considered normal. 3 centimeter defines AAA, and greater than 5.5 centimeter is considered pretty darn big. Over 90% of them are below the renal arteries. Ultrasound screening is very sensitive and specific. Here's another question for you. Most AAAs, pause the video and answer the question. All right, what did you say? Most AAAs are asymptomatic. But what is the classic triad for AAA? I want you to pause the video again and answer this question. The classic triad for AAA is abdominal pain, shock, and a pulsatile abdominal mass. But less than 25% of ruptures present with the classic triad. That means 75% of them present without the classic triad. Quick fact, mortality for a ruptured AAA is about 90%. So basically, if it ruptures, you're in a world of hurt. Risk factors include smoking, alcohol use, hypertension, atherosclerotic disease, and genetic factors. Prognosis, I want you to kind of pause the video and take a look at this chart. Basically what we're saying is a small AAA has about a 0% chance of rupture, but it grows about a third of a centimeter a year. A really large AAA has about a 20 to 50% chance of rupturing in a year. Typical recommendations for follow-up, this varies among community, but in general, if it's less than 3 centimeters, there's no need for follow-up. And then you can pause the video and look at this chart for the other sizes. Let's talk about pipes a little bit. I use this with my residents to talk about the diameter of things in your ultrasounding. Basically, this is a PVC pipe I cut in different directions. And if we ultrasound something straight on at a right angle, we get a nice circle. But if we ultrasound something kind of cut across it, this looks really big and wide. So you need to make sure that when you're ultrasounding any type of vessel, you want to make sure you're hitting it at a right angle so you're getting an accurate reading and not some elongated, falsely wide reading. So potential pitfalls of ultrasound for screening for AAA. You'll like the pipes, make sure that it's a transverse scan. That means at a right angle to the vessel. We don't want to cut through it at a weird angle and get a false measurement. You're not scanning through the center of the lumen could cause false measurements. Also, there can be false lumens with a mural thrombus. Look at this picture. You see this nice little blood vessel right here, but in actuality, there's a AAA with a mural thrombus. So this is the actual diameter, and this is a thrombus in here. So you need to make sure you're following the entire length of the vessel, and it'll be easier to get this and notice this, and just keep an eye out for this because this is something you don't want to miss. Down to the nitty-gritty question for primary care providers. In your office and in your situation, when would you do an in-office abdominal ultrasound? And when should you refer to radiology? I hope you enjoyed this quick overview. I highly recommend for people who want to watch videos on how to scan to look up UC Irvine's iTunes University Emergency Ultrasound Curriculum. They have a whole bunch of videos in there and they're really helpful. There's a AAA one, but there's a lot of other videos I hope you can find helpful. This is Dr. Jeff MD signing off.